All right, so here we are, turning 65. What are the Medicare choices? Well, before I begin our training today, I want to introduce myself. My name is Rana Draysat. I was born in New York, and I was raised in Downey, California. I've been a licensed agent since 2009, and I've been an independent broker since 2013. Our team has helped thousands of individuals enroll in health plans. A few of the benefits that we offer are an unbiased look at over 20 different insurance companies. Having an advisor on the ground. That means that we're in the field working with people talking about Medicare every single day. Our job is to stay on top of new rules, regulations, and changes that might affect you. We review your coverage every year to make sure you're not stuck in a plan that might not cover something you may need for next year. And best of all, there's no cost for our help. We represent all the major carriers and have access to many others. Now, today we will cover Original Medicare, what Medicare covers, your choices, a Medicare Advantage or a Medicare Supplement plan, what a Medicare Advantage plan is and how to compare them, what a Medicare Supplement plan is and how to compare them, Part D prescription drug plans, and all of the important enrollment dates. So let's dive in. Now, before I go any further, I did just want to reference that all of the information I'm going to be giving you today is right out of the Medicare and You Handbook. If you don't have a copy, you can go online and view a copy of it electronically or order one from Medicare's website. This is the official U.S. handbook that has all of the necessary information you need to know about Medicare in it. It's just a rather dense reading material, so I've simplified things to help you make more sense out of it today. This page is right out of the Medicare and You Handbook. So let's start with the basic parts of Medicare. What are the parts of Medicare? Well, you have Part A and Part B. Those are the original Medicare hospital and medical insurance. Later, Medicare Part C and Part D were added. You can see that Medicare Part C is not listed on this page because it's also known as Medicare Advantage, and we will discuss that separately. And then Part D is your prescription drug coverage. So let's get started at the top and talk about what is Medicare Part A hospital insurance. First off, some things to know about Medicare Part A. Most people are eligible at age 65. There's no cost for Part A as long as you've worked for 10 years or 40 quarters and paid taxes into the system. Medicare Part A works with any hospital that accepts Medicare nationwide. Your benefits will restart after you are out of the hospital for 60 consecutive days. So it works on a per hospitalization basis, not per year or per benefit period. You also have what's called lifetime reserve days. Once you've used those days, they'll never be available again. I'll talk about that here on the next page. So, if someone has original Medicare Part A coverage, Medicare is going to cover 90 days of inpatient hospital care. So if someone is hospitalized, what are the out-of-pocket costs? Well, first of all, you have what's called a Medicare Part A deductible that you would have to pay per hospital stay. So, if you were in the hospital anywhere from 1 through 60 days, the deductible is $1,408 for this year, for 2020. After that, Medicare picks up 100% of the cost. Now, if you happen to be hospitalized for more than 60 days, then on day 61 and thereafter, through day 90, you'd be responsible for a $352 copay each day. So someone with only original Medicare coverage, if they were to be hospitalized for a 90-day stay, that could potentially be $11,968 out of pocket. Now, once we hit day 90, that's when those lifetime reserve days come into play. So if someone is admitted inpatient to a hospital beyond 90 days continuously, Medicare has what's called lifetime reserve days. That's where Medicare will pick up the cost except for $704 of each day of that stay for those additional 60 days. And if these numbers look expensive, they are. Medicare does not have an out-of-pocket maximum or a cap on what the beneficiary could be exposed to pay. Now let's take a look at Original Medicare Part B. So most people become eligible at age 65 for Part B. But if they continue working and have group insurance or other benefits, they may delay enrolling in Part B until a later date. Now Part B does have a monthly premium, which starts at $144.60 per month, but that could be higher depending on if you have a higher income. That premium is typically deducted right out of your Social Security benefits. If you're not receiving Social Security benefits yet, then you can set it up to be paid directly to Medicare. Medicare Part B works with any doctor or facility that accepts Medicare nationwide. So there's no network, and it's almost 1 million providers now, or just over 1 million that accept Medicare. So someone with Medicare Part B coverage only would have a deductible when they go to doctors or outpatient facility or other lab services, etc., a once per year Medicare Part B deductible of $198. And after that deductible has been paid for the year, Medicare pays 80% coinsurance. So the beneficiary is then responsible for the other 20%. Some doctors, though, can choose not to accept Medicare assignment, and they may charge what's called an excess charge, and that's 15% above what Medicare would have paid that doctor if they had accepted Medicare. So along with Medicare Part B, there's no maximum out-of-pocket or cap. So let's say, for example, a $100,000 outpatient cancer treatment. Medicare would pay 80% of that, Part B, but the beneficiary would still be responsible for 20%, which would amount to $20,000 out of pocket for a $100,000 treatment just in that scenario. So now that we understand the basics of how Medicare Part A and Part B work, the next question to ask ourselves is, how will we receive our Medicare benefits? So there's two ways to really go about it. Option one would be Original Medicare. If you're looking at the chart here, on the left is what you would have with Original Medicare. So you would have your Part A, which is your hospital insurance, your Part B, which is your medical insurance, and you would have a Medicare supplement or a Medigap policy picking up the difference for most of the difference. And then you'd have a Part D prescription drug plan for your prescriptions. Now, this option on the left, option one, can get a little pricier or on the pricier side, but in some cases, you can have a majority of your out-of-pocket expenses covered. Now, option two, which is going to be on the right side of this chart, is a Medicare Advantage plan, also known as Medicare Part C. So most, but not all Medicare Advantage plans include prescription drug coverage. Look at Part C as a combination of Part A, your hospital benefits, Part B, your medical benefits, and Part D, your prescription drug coverage, all together in an all-in-one plan. Now, they're designed to provide benefits equivalent to Original Medicare, and most Medicare Advantage plans include extra benefits that option one, which is Original Medicare and Medicare supplement plans, for example, don't offer. But one of the key differences is that they actually have a maximum out-of-pocket limit each year, and that can be as low as $0 up to a maximum of $6,700 per year, depending on the plan. All right, So let's look at some important facts on Medicare Advantage prescription drug plans, or Part C. So you must have your Part A and Part B. Part C plans are usually $0 or low cost. You still pay for your Part B premium, but some plans even include a reduction of Part B premiums. Now, most plans, like I mentioned, do include prescription drug coverage. Most plans also include additional benefits. So original Medicare and Medicare supplement plans don't offer these benefits. And these are benefits like hearing, dental, vision, transportation, silver sneakers, and more. And again, it's at no additional cost to you. So a couple of key features on Medicare Advantage plans. They're guaranteed coverage. So when you turn 65, you have 3 months to choose a Medicare Advantage plan after you enroll in Part B. And after those 3 months, you need to wait until AEP, or annual election period, to enroll or be eligible for a special enrollment period. So the way it works basically is you have 3 months from the date before you turn 65, the month of turning 65, and 3 months after you turn 65 for guaranteed coverage, as long as you have both Parts A and Part B. Now, again, there are extra benefits at no additional cost to you. So most plans include these benefits that are like prescription drug coverage, hearing, dental, vision, transportation, over-the-counter benefits, silver sneakers, and more at $0 per month. It doesn't cost you anything. And best of all, you get peace of mind. There's a maximum out-of-pocket limit. So like we mentioned earlier, original Medicare Parts A and B have no limit or cap on what you have to pay for out-of-pocket. Every Medicare Advantage plan has a limit, and that ranges from $0 up to a maximum of $6,700. So you'll always know what the maximum is that you'll be responsible for. So the next question is how to compare Medicare Advantage plans. Well, the most important thing you want to look at, aside from the monthly premium, are the copays, whether it's an HMO or PPO plan, if your doctors are in network, are your prescriptions covered, and what are the extra benefits really? So again, plans are going to be anywhere from $0 or just really low cost. So here is an actual comparison of some plans in Orange County, California. And here's a couple of major carriers side by side with original Medicare. So we have WellCare, Anthem, and Humana. All of these plans are different plans. All have $0 monthly premium. Now what I did is I compared WellCare and Anthem side by side and then took Anthem and Humana side by side to compare all 3 options. Now, as you can see here, the biggest difference between WellCare and Anthem is that WellCare's out-of-pocket maximum is $3,400 for the year, while Anthem only has $900 maximum for the year. Office visit specialists for WellCare, $5 copays, $0 copays for Anthem. Same with PCP, or your primary visits. Hospitalization, $0 copays. When we take Anthem and put Anthem side by side with Humana, you have a $90 difference between them as far as the maximum out-of-pocket. So Anthem's maximum was $900. Humana's maximum for the year of what you'd have to pay would be $990. Very similar as far as coverage down here. Primary care visits, specialist visit copays, even inpatient hospitalization, $0 copays. Now between these 3 plans, the WellCare, Anthem, and Humana, since Anthem has the lowest out-of-pocket maximum, I'm going to go ahead and compare that one side by side with original Medicare very quickly. So at a glance, as far as a deductible, Anthem has a $0 deductible. Original Medicare Parts A and B, Part A has a $1,408 deductible, and Part B has a $198 deductible. Out-of-pocket maximum, again with Anthem, for the Medicare Advantage plan, $900 for the year. With Medicare, original Medicare, there's no limit. Office visits, specialist $0 copay with Anthem, and for original Medicare, you're paying 20% of the cost. Inpatient hospitalization, $0 copays with the Anthem plan. With original Medicare, it's a $1,408 deductible for days 1 through 60, a $352 copay for days 61 through 90, and a $704 copay per day for 60 lifetime reserve days, and that can add up. Again, no limit. So again, as I mentioned earlier, the biggest difference that's going to be between the different companies or the different carriers for Medicare Advantage plans are going to be what benefits they offer. So here's a chart and an example of the exact same plans that we just went over. And they go over what benefits these plans include. So Part B Give Back, WellCare offers that, and Anthem also offers that. Humana doesn't, Original Medicare doesn't. If you just take a look at the right here, Original Medicare does not offer, so Part A and B does not offer any of the benefits, such as Part B Give Backs, dental services, vision services, hearing, over-the-counter, fitness benefits, silver sneakers, and even transportation. And between these three plans, Anthem offers all of those benefits. So let's take a look at an example straight from the Summary of Benefits. This is for 2020 for an Anthem Medicare Advantage plan. Hearing is included. So the plan covers hearing exams and even a $0 copay for hearing aids up to a maximum of $3,000. Dental services. Not only are your basic preventative dental services included with this plan, it's 2 cleanings, 2 exams, 2 x-rays, $0. And with this particular plan, it's a $250 allowance or a $1,000 benefit for comprehensive dental services every year. So that's for your root canals, your dental crowns, your bridges, implants, even dentures. That's all included with this plan at $0. Vision is included as well. So the plan covers 1 routine eye exam, and it offers a benefit of $200 for glasses or contacts each year, and it's a $0 copay. Transportation is included at $0. Over-the-counter items such as blood pressure monitors, even vitamins, minerals. It could be cough drops, cold medicine, any of those over-the-counter items that are approved and non-prescription. You'd receive $135 as a benefit every quarter, and they do roll over every quarter. Silver sneakers, it's a fitness program that's included as well, $0. Some plans, this one particularly includes a personal emergency response system. Medical equipment and supplies are included. This plan has diabetic supplies and services for $0. Plans include a 24/7 nurses hotline. Some even include pest control. There's also a lot of different extra benefits that can be included in plans at $0. Now, it's important to know what benefits are really important to you and your new health plan. Why? To make sure that you're in the best option, the best possible option for what your needs are. So let's take a look at some important facts about Medicare supplements. Now, the first thing to understand is that you must have Medicare Part A and Part B to be able to purchase a Medicare supplement plan. You'll pay a monthly premium for your Medigap policy, and that's in addition to your Medicare Part B premiums every month. Medicare supplements cannot include prescription drug coverage. That's where Medicare Part D would come into play and be purchased separately. Medicare supplement premiums and costs can vary by company and plan type, and they usually increase as you get older. Now, Medicare supplements also have a unique enrollment period. So when you first turn 65 or enroll in Medicare Part B for the first time, you have 6 months to choose any Medicare supplement without answering any health questions. After those 6 months, insurance companies can ask health questions, and they can even decline your application if they wish to do so, since it's not a primary health insurance plan. Medicare supplements can be used with any provider that accepts Medicare, and they're standardized. So that means that insurance companies can only sell you a standardized policy identified by one of the 10 plan letters. So basically, different insurance companies can charge different premiums for the exact same policy. Now, here's a chart with the 10 different Medicare supplement policies. Plan S, for example, over here, right in the middle, covers all of what Medicare does not pay. Now, that plan is no longer offered for individuals that became eligible for Part A after January 1st of 2020. Plan G is similar in regards to the benefits over here, but the Part B deductible isn't covered by the plan. So really, when comparing Medicare supplements, what you want to do is find out what your total out-of-pocket costs would be. You want to keep in mind that different companies can charge different premiums for the same exact policy. So even if it is an apples-to-apples comparison, what you're going to really look at is going to be the monthly premium for the plan type that you want. Now, up to this point, we haven't talked much about prescription drug plans because we haven't gotten to the Part D section yet. Now, one major difference between Medicare and most other health insurance that you might have had in the past is that the drug benefits and the medical and hospital benefits are not connected to each other. So Medicare keeps Part D separate completely. So whether it's included in the Medicare Advantage plan or you're purchasing a Part D drug benefit on your own, these plans are completely separated from the medical side of the benefit. Now with Medicare, they have their own out-of-pocket costs, their own premiums, copays, deductibles, etc. And that's what we're going to go ahead and talk about now. So here are some important facts with Medicare prescription drug plans. Medicare prescription drug plans may have a monthly premium and an annual deductible, but the deductible is usually waived for Tier 1 and sometimes Tier 2 medications. So if you're just taking generic drugs and you see a plan that has a $400 deductible, it might not mean that the deductible applies for your medication. Prescription drug plan benefits work off of the calendar year. So that's January 1st through December 31st. Every single year, it's that cycle. And even if you're signing up for one plan in the middle of the year, it's going to reset in January every year. Each plan does use a formulary. So this is the individual list of drugs that are covered by that particular plan. And some companies even offer multiple plans with different formularies. So it's really important to look at that when comparing options. Now, Part D plans also have different tiers. So as I mentioned before, Tier 1, Tier 2, 3, etc. And each company has different tiers and copays for those tiers. In some cases, the drug might be on a different tier between two different plans. So it might be a Tier 2 medication on one plan, which would be a lower copay or lower cost, and a Tier 3 on another. So again, it's very important to take a look at that when you're comparing. Some plans also have what's called prior authorization and quantity limits. So some drugs require that you and your prescriber to contact the drug plan before you can even fill certain prescriptions. Your prescriber may need to show that drug is medically necessary for the plan to even cover it. Quantity limits just say how much of a medication you can get at a time to cover. So if you've had any prescription drug plans in the past, this is kind of typical. Most companies have a verification process to ensure certain drugs are covered, but you do want to keep an eye out for that with your drug plan. Now, another term you might hear with Medicare Part D is step therapy. That would be where a company would require for you to try one or more similar low-cost drugs before they would even cover a prescribed brand name drug. Now, this takes us to the important enrollment dates. So, since we talked about original Medicare Part D and Medicare Advantage plans, we'll go ahead and talk about that first. You're going to need to get enrolled into original Medicare. So the easiest way to do that would be to go online. And you can also go in person or call Social Security at 1-800-772-1213. If you're a railroad retiree, that number is 877-772-5772. Now, if you're already receiving Social Security benefits before you turn 65, actually, you can relax and sit back because your enrollment will be automatic. Now, you will get a Medicare card in the mail around 3 to 5 months before your 65th birth month. But for the rest of you, the enrollment period is as follows. You have 3 months to enroll prior to your Part B effective date. Then you have the month of your Part B starting, and then 3 months after that month. So the total enrollment period time here for original Medicare, Part D, and or Medicare Advantage plans is a total of 7 months. Now, Medicare supplement plans have a lock-in period of up to 6 months prior, and you have an enrollment period of 6 months after your Part B effective date. And if you miss that 6-month date, you may have to answer to health questions, which could also mean that you have higher premiums. So what's next? Option 1 would be to start calling 30 different places to get rates and information. Or option 2 would be to let us do all of the heavy lifting for you for free. If you're leaning towards option 2, then give us a call at 866-865-4779 or click below and you can choose a date and time here on the calendar and just book an appointment on our calendar right there. And a reminder will be sent to your phone and your email, so make sure to check your email and or text messages for a confirmation. Talk to you soon.